There are calls for 1 million people to volunteer to become Dementia Friends volunteers, able to spot signs of the illness early and help sufferers. Is a government plan to raise awareness of the condition? Our health correspondent Dominic Hughes reports.
And you stuck those on yourself, haven't you? Yeah.
At a daycare centre in Oldham, John Starkey and his mother Anne are already preparing for Christmas.
Love from Anne. Should we write love from Anne?
John is a full-time carer for his mum, who's been diagnosed with dementia. Here, Anne is among understanding friends, but outside, she needs a little more consideration.
There are times when, obviously, she can't perform as everyone else can, and you just need that little bit of extra time to do things, and that little bit of extra space to do an activity or an action. If people are a bit more patient with her, then the results from her are better.
In centres like this up and down the country, there's always a warm welcome for people with dementia and their carers. But the Prime Minister wants everyday places like supermarkets, banks and GP surgeries to become much more accessible for people with the condition.
And do you normally live at home on your own?
And that's where the Dementia Friends come in. Ministers are calling for 1 million volunteers with government-funded training to raise awareness of the condition.
And part of the challenge is not just what happens in the NHS, where there are pockets of excellence but lots to do, but also what happens out and about in society, and to have a much bigger understanding.
You feel trapped.
At Swanhurst Secondary School in Birmingham, Emerson Jones is laying out the reality of life as a carer. He's come to the school with his wife Ruby, a former midwife and nurse who's been diagnosed with dementia. They're taking part in a project to raise awareness among school pupils in England of a condition that Emerson feels is often hidden from view.
You don't see dementia mentioned as a topic. And as I say, if you go to any doctor's surgery and you look at the various notices in the doctor's surgery, you don't see anything. You cannot have an informed discussion with your GP about the dementia.
The ambition behind the Dementia Friends scheme is to transform attitudes, not just in classrooms like this, but across society. Dominic Hughes, BBC News, Birmingham.
Well, for more on this now, we can speak to Karen Harrison-Denning, who's the head of Admiral Nursing at Dementia UK. She joins us from our central London studios. Very good afternoon to you. Thanks for joining us. What do you think of this idea of Dementia Friends, then?
I think we would welcome as much as possible to raise awareness and knowledge of dementia within the wider community. So I think in that sense, it's a good initiative. What really concerns me is that we really do still need much more investment in specialist services from that point of raising awareness through the whole journey, the whole trajectory of a family being affected by dementia.
The Health Secretary was saying this morning that this kind of project has been transformational in countries like Japan, which have been dealing with an ageing population for a little longer than we have. Do you think it can be transformational here? I mean, a half of dementia sufferers still go undiagnosed. Would it help with things like that, do you think, if people are more aware?
I think learning lessons from other countries like Japan, we should harness those opportunities, and I'm optimistic, as we all are in Admiral Nursing, that this will continue the good work that has been felt since the introduction of the National Dementia Strategy in raising awareness of dementia. But we still do need to up the ante, up the skills of generalist practitioners. So you talked about general practitioners, GPs. We still need to ensure that a greater number of people actually do achieve a diagnosis. We're still only achieving around 40% diagnostics at the moment in dementia. So raising awareness might enable that to improve, but we still do need to consider thereafter the diagnosis what specialist support and interventions those families affected by dementia might experience and access.
So a lot more work needs to be done within the NHS, of course, but in terms of this, if we focus on this project, I mean, they're looking for 1 million volunteers. Do you think they'll get that?
I would be very surprised if not. There are a lot of communities already that are very supportive and very knowledgeable of having an awareness of dementia, and certainly if you look at many villages. There's already movements within those villages to support people with dementia that are within that community. And certainly I'm part of a very active community myself in Cambridgeshire, which does have people that they may not have had the initial training that is proposed within this scheme, but are dementia friendly, are dementia aware, and are looking out for people within their communities. And I think that this would be a good exercise to extend that. I think that where we do need to link up, again I come back to specialist services, is we could actually utilise and engage the dementia friends within existing systems to support the work that specialist practitioners do also.
So you're happy, you're satisfied that 1 million people will volunteer. Do you think, though, I mean, that million will have training, their awareness will be greater. Will that translate into wider society and a changing of attitudes generally, do you think?
I think that's what's hoped. When you think of 1 million volunteers, 1 million people, it'd be interesting to see where they're actually recruited from, what type of people they might be. I'd be very interested to see what level of knowledge and information they're given to enable them in that role. And I think that one thing we do have to acknowledge is how acceptable that individual would be to families that are actually affected by dementia. As we've heard in earlier news reports today, there is a degree of scepticism as to how helpful those individuals can be.
Okay.
But lessons can be learnt from other countries, and we're hopeful.
We must leave it there. Thank you very much indeed. Thank you.